I want to talk about one patient that I saw recently. He's a young man have hepatitis B. He came, and after explaining everything about hepatitis B, I normally give the patient some special advice. I will tell them that as a happy carrier, he's obliged, okay, not by law, but he's obliged to tell his sexual partner, his spouse, his parents, his sibling about his illnesses. Why? Because he could pass it to the spouse, or maybe he get it from the spouse. So the spouse or the sexual partner should screen for hepatitis B. If they're not infected, go for the vaccination. Testing and vaccination need not be done at a specialist clinic. They can easily go to a polyclinic or go to a family doctor, go to a GP, go to a company doctor to have a simple blood test and a simple vaccination. They should inform their parents because sometimes they get it from the parents. They should also inform their siblings because maybe the siblings that are born of the same mother get the Hep B from the same source. Yeah. Besides that, I told my patient that they are not obliged to tell their colleagues or their employer about hepatitis B. The few things that happy patients should not do. In Singapore, a happy carrier cannot be a medical doctor. In some other countries like Europe, a happy carrier cannot see patients if their viral load is high or detectable. So in Singapore, if I have seen before that medical student passed through the tough interview to be a medical student, but before they become a doctor, they were tested positive for hepatitis B. Because of that, they were told that they would not be given a place to study medicine. Sad story, quite a number of them. So as a happy carrier, you cannot be a doctor in Singapore. You should not also do things that involve blood. I think being an MMA fighter, being a boxer, being a competitive sports, contact sports like a soccer player may not be a good idea because if you have injury on the court, injuries on the field, your blood may contain the virus and then may transmit to another person. But besides contact sports, besides being a medical doctor, I told my patient happy carer can do anything that I can do. They can be a teacher, they can be a lawyer, they can be an accountant, they can be an office worker, they can be a bus driver, they can do anything that everybody else can do. Yeah. Another part is that I saw this very sad case that the patient came, is a young man. And when I asked him, have you screened your family? Actually, her parents come with him. And the mother had a very guilty look. And mother say, I think I passed to him because I have hepatitis B. And then the father of the patient say, actually, Dr. Y, I am also hepatitis B. I used to be a blood donor, but later they told me that I got hepatitis B, so I stopped being a blood donor. The doctor suspect I get it from my wife. In other words, the husband of the patient, my patient's father and my patient probably got hepatitis B from the mother, from the same person. And this nice, pleasant old lady had a very guilty look. I told her, you don't have to be guilty because it's not your fault. You didn't ask to pass the virus to your husband or to your son. Happy vaccination only started in 1987. Before that, people don't get happy vaccination. The knowledge of happy is very poor in the past. So she could have passed to the husband without she knowing it. And she could have passed to the son without her knowing it either. Besides that, her being a happy carrier, most likely she get it from her mother. And of course, she shouldn't blame her mother because her mother probably get from her mother, etc., etc. So a happy carrier, they have the virus, they know about that, they could unknowingly pass to the husband or the sexual partner or the children. That was in the past. From 1987, we vaccinate all the newborn in Singapore, and nowadays we have very good medication that can prevent a happy carrier mother to pass to the child. So to sum up, I told my happy patients what to do, what not to do. They don't have to tell everybody they're happy. In fact, I asked them not to because the public had a very different perception of hepatitis B. They think happy is like HIV, they are naughty, they sleep around. No, it's not true. A lot of time they do everything right. They just don't know they're happy and they pass it around. And they have to see the doctor regularly. They have to screen the family members. They shouldn't involve in contact sports. Unfortunately, in Singapore, they cannot be a doctor, but in other countries, the rules are slightly different. But I always told my patients, I have a lot of happy patients, follow them for years, they are well, and they live a normal life. They don't have to be worried. They can live a life normally, like having kids, having a family, having a successful career, being a good parent, etc., etc. This is Dr. Desmond Y from the Desmond Y Clinic. Thank you.